I'm Sangeetha Ajay Singh. So I'm going to cover the chapter 4 and 5. Chapter 4 is a digital infrastructure and chapter 5 is a digital operation management.
Can share your PPT.
Yes, sir. Digital infrastructure. So it's basically all the computer stuff in a hospital, like the computer themselves, and an internet connection and the software, which is used to keep the track of a patient and also the information and to communicate with each other. Like our friend said, everything we have to document the patient records digitally. What is digitally means? How do we document digitally? So we in a hospital documented digitally with the help of hospital information managed system. And there are a lot of benefits of having digital health technology because it can be used anywhere, everywhere, and it can reach to many people. And it's often a cheaper, and we can reduce the travel time. We, in the sense, patient can reduce the travel time, resulting benefit to the environment, and it also empower the people to manage their own conditions. So let's have quick summary of digital infrastructure standards. Digital infrastructure standard has two standards and 14 objectives. And the two objectives broadly ensures how the patient information is accessible and the medical devices are connected, how the communication between healthcare professional and other staff should happen, how the digital infrastructure helps to reduce error and ensure the data privacy. And the first standard broadly explains about the accessibility, compatibility, and the hardware requirement to access with the software and how the power been backup and data is been backup. So let us jump on the first standard. The hospital uses communication and technology capabilities to facilitate the digital operation. As I said, the hospital should ensure a platform of URL to access the HIMS. So how this HIMS can be accessed? It can be accessed through the URL which we call as Uniform Resource Locator. How a patient can access, how an hospital staff can access through the web portal, or it can be accessed through the mobile portal also. And your URL should be very clear in a descriptive manner, and it should be user friendly for the disability users also, where they can use the text to speech and software or a screen reader. And secondly, once we have given an accessibility of an HIMS, and now what if it is not performing in multiple browser? So the hospital should have a multiple browser compatibility. Like what is mean multiple browser? Multiple browser means it is Mozilla, as we are using in a regular day-to-day life in our hospital, in our workplace also. Like it should be compatible with the Mozilla, Google Chrome, Microsoft Internet, Apple Safari, Opera. Like there are so many platforms available available, so that the accessibility should not get any issues with the compatibility. And and thirdly, we have provided, now the hospital has provided with the accessibility and the compatibility platforms. And now what is required to actually use this software? We just cannot use the software virtually. Yes, we need to have a hardware component. So here, this objective says a medical practitioner who actually talks, who actually interacts with the patient, who records the health record of the patient, must be provided with a hardware, like either be a computer, laptop, tablet, or a smartphone, which can make the accessibility of the electronic record anytime and anywhere. Anywhere, what I mean is remotely also a doctor can able to access the patient. And likewise, the hospital should also provide the same equipment like an hardware to the other hospital staff members also, with an computers or a mobile devices to enable to achieve the hospital operations. And it is very easy to manage patient data anywhere in the hospital. And what once we have provided the hardware compatibility and accessibility, now we need to provide a backup for an internal network also. And what does internal network mean? These internal networks are nothing but, see, every day we share a document, we share a file, we share a file, and we use the printers, and we use many, connecting source to the internet. And these need to be get backed up, because there will be an always a chance of a data loss, and which will end up in a disaster or an emergency. In order to retrieve this data loss, we have to maintain a security and integrity of a patient data with the help of a proper backup plan for a internal network also. And hospitals should also have a power backup to an entire digital system. Entire digital system, I mean the hospital HMIS. It can be in any other applications of the hospital. It can be an any digital equipments also. To, in order to function properly without an interruption of an operation, we the hospital should provide with an uninterruptible power supply is called an UPS and a generator. I know this is now most of the hospital, 99% of the hospital is already ensured. Yes, but this is also one of the objective in this chapter. And then the hospital uses digital system that suppose single sign-on capabilities. What it means exactly? The single sign-on capability is a technology where a user can authenticate himself once, and he can log in multiple applications. Let me give one example. As if you can log in a Google server, you can able to log in this multiple Google application like YouTube, Google Ads, and you also use the Drive. You also use the Google Photos. So with one sign in, you can access multiple applications. Likewise, the hospital should also facilitate with such system for the HIMS. And the hospital uses a digital system is largely deployed. And where do we store all this data? Where do we store all this data? There need to be in one solution. The most recommended solution in this digital world is a cloud-based deployment, which means the cloud-based deployment is the servers are hosted outside the hospital location, and it is managed by the cloud provider. On the other hand, yes, you can also store a data inside the premises also by managing internal server. But the most recommended is to store a cloud-based servers. And finally, NABH recommends to use mobile devices rather than in fixed devices to a good accessibility. Why? Because the mobile devices like tablets, laptops, smartphones, you can carry anywhere inside the hospital, and it is very easy to use it also. You don't have to really wait for the uh, broadband networking and all. You can just use with the help of the Wi-Fi. And let me give one example. A nurse going for an IP round, if the nurse can able to carry a tablet with her hand, she can able to easily record the vitals where record the vitals in a very few minutes of time. And this will totally exempt the paperwork. And the second standard, what the second standard talks about, it talks about the data security and how the data being secured. Now we have given an access, we have given the compatibility, and we have provided the staff with the hardware and the software solution, and the data is also recorded in a daily manner. And now how do we ensure this data is encrypted? And now what is encryption? Encryption is nothing but a converting an information and any sensitive information in an unreadable format. And such encrypted data can only open with the help of a specific key or password. If in a regular day-to-day life we use this platform in a WhatsApp, in most of the social platform, like in WhatsApp, like in a Telegram, all the data has been encrypted. The same way the hospital data must be encrypted. and this will ensure the privacy of the patient data, and it also prevent from the unauthorized access, so that the hackers so that the hospital will not give a scope to get the data being hacked. And number two, there is another way of another shield also, like a hospital should have an antivirus, so that it prevents the data, so that it prevents the data to get affected with the viruses. And it also, this antivirus particularly prevent the data from the antivirus, and in case if any antivirus is been attacked to the data and it is detected, and again it is removed from the hospital application, and henceforth we need to the hospital need to have an antivirus program, a software program in place. And number three, what if we have now we have protected the data, now we have again protected the data with the anti viruses also, but there are another thing, our network, hospital network can also be hacked, or it can be get traffic. For those hospital network data, we need to protect by using few firewalls. And there are four types of firewalls, which the software firewalls it can you which you can directly install on the computer or a device which you are using. And you can hardware firewall, these are the devices which protects the entire hospital network. And the thirdly, next generation firewall, these are the advanced firewall which actually block all the traffic hacking system in on a specific application. So this is a much advanced firewall system. And the fourth, finally, cloud firewalls. This cloud firewalls actually protect the cloud data being get hacked, being get trafficked. And this is how all the data being protected and secured in the digital system. And and now the objective, this objective talks about when HIMS captures the data, this data is captured in the audit trail manner. What is audit trail? Audit trail is nothing but the chronological record of every activity being occurred in the system or application. Like in a traditional method of a hospital, what do we do? All the patient record being chronologically arranged in order in the file, physical file. Likewise, in the same manner, in a digital manner also, the system should chronologically get recorded. Every activity happens in the system. For example, let's say in the context of the patient records, the patient may log in from various the patient get login from when a patient get login and get been accessed, we need to able to see who has been accessed, when it was been accessed, and what are the changes been accessed. So this can be done by implementing this audit trail in place. And lastly about the digital infrastructure objective. This objective means there need to be a digital mechanism which allows secure access of hospital data to remote location. So to see now, we have spoke about the telemedicine also. What is telemedicine exactly? Telemedicine is the accessibility of an healthcare system remotely. So in order to perform such process, we need to have three things in place. One, a VPN system, which actually allows the users to access securely the hospital network and the data from the outside of the hospital. There is another way, cloud-based service also, is the hospital data is accessed from anywhere with just from an internet connection. And finally, hospital can also access from the remote desktop software, allowing the authorized user to get access on their own computer from the data given in the remote location. So this is all about the digital infrastructure chapter. And let's talk about digital operation management. Let's have a quick summary of a digital operation management standards. This chapter has 6 standards and totally 25 objectives. Let's broadly talk about what are these What is this digital operation management means and what the standard exactly talks about? When we talk about digital operation management, there need to be an IT policy. There need to be IT policy, written IT policy to how to operate the IT resources and the whatever the infrastructure is given, it need to be get managed smoothly with the help with the digital operation. And thirdly, this chapter speaks about how this digital system manages the IT assets. What is digital assets and the IT assets? Like how we manage our other fixed assets in the hospital, we must manage the IT assets also within the HMIs itself. And it also talks about the disaster recovery plan, so that if any case of any disaster, the service will not interrupt with the digital system. And it also talks about the access control, how the data being secured once again in a broader manner. And finally, digital system to like in a like other like in a hospital, we capture if any incidents occur. The same way, all the incidents occurs in the hospital and the maintenance events, anything happen in the facility, our digital system should be able to maintain and manage it.
With another 10 minutes.
Firstly, first standard, the hospital uses an IT policy and to manage the digital operation. The hospital should have a written policy and uh, procedures to use and manage and about the security of the hospital IT assets, and it should also include the policy should also include the data privacy, security protocols, and how the password being managed. Um, and it's not only the policy and procedure talks about the data privacy alone, but it should also lay the guideline who all the staff who all the staff or employees are using which machine, which equipment, as well as the which software. And this guidance will also cover the data privacy and security protocols. And once the IT policy is laid down, and this IT policy should be periodically reviewed, like like any other policy in NABH standard, or every policy and procedure is reviewed periodically. Likewise, this IT policy should be reviewed periodically. And hospital should also monitor the performance of the other hospital should also able to the digital system of the hospital should be able to manage the internal maintenance plan of IT system and services within the HIMS itself. Continuous support, including software update and upgrade for the clinical health application. What it means, the the software need to be the software need to be regularly updated, and and with the upgradation to the software will always ensure HMIs are up to date with the latest security patches, and it also fixes it bugs, and it also prevent the data breaches also, and it also ensure HMIs run smoothly. In addition to this, software upgradation very often introduced with new features and functionalities to the system. And next, like the HMIS, other hardware systems should also get update very regularly and very often. Like the hardware, I mean, a desktop, laptop, mobile, or any other database should be get updated and upgraded very often, so that any new features and functionalities will also get upgraded within itself. And the hospital uses a formal change request managed to manage IT related changes. What it means, if the hospital needs to implement a new change, or they wanted to change some features. So in order to that, there need to be a standard laid down procedure. First, they should raise a request. Then the request should get approved. Then the approved request has to be been sent to the testing phase. And once if it is okay from the IT side, then it will be implemented and finally been monitored. And how this request it's been request been formally managed. It should be managed with the help of various software applications like ServiceNow or a Jira. What the ServiceNow and Jira? This is all the tools to communicate with the software development team in order to handle the any change request in the hospital.
Another 5 minutes, Sangeetha.
And then the hospital uses a digital system to manage inventory record of all the IT assets. The HIA should be able to manage the entire inventory record of all the IT assets. What all the IT assets? Again, it's nothing but all the hardware components, the networking devices, and the software. So it should also have an history from the procurement to the till the maintenance plan. Everything is should be recorded within the HIMS about the all the IT asset. And the data should be and the digital data should be centrally stored in one location. And the HMIS should also record and track the IT security incidents if anything happened or any issues occurred, any changes were done, if ended with any problem. So everything in IT service management should be able to record, and it should be able to track the security incidents, issue changes, and plan. And and next, the hospital periodically conduct IT audit internally to confirm no major vulnerabilities. What it means, the IT audit, the IT audit should the IT audit should have an independent evaluation so that it can audit the infrastructure and policy procedure and the controls given in a hospital. So everything should be audited periodically, so that it can prevent the risk and vulnerabilities of the IT environment, and henceforth the IT functions very effectively and controls were not being misused. And next, the hospital produces the hospital waste. Digital system also produces the e-waste, which we call electronic waste. And these electronic waste should also be maintained, and it should be tracked, very well. And when it comes to the disaster recovery plan, there need to be an policy and procedure to manage the disaster, and also to manage the recovery of the hospital data if any unforeseen incidents happens. And for that, we hospital should write a policy and procedure for it. And after having a policy and procedure, once in case if the in case what if any disaster happen, how do you recover the data? How do you recover the data related to the administrative application? In that case, there are disaster recovery options where the hospital can use cloud-based backup, secondary data center virtualization, and finally the data replication. With all this recovery option, the hospital can able to recover the data. And the hospital should also able to retrieve the data, or it should be able to archive the data. by using an hardware or a cloud storage or any network attached storage which storage system within a premises also. And finally, the standard says about how to manage the end user credential and authentication. The hospital system, the digital system should be provided with a credential to the user. If you see, if as a patient or as a staff, will be given with a credential of username and password. And once the user is using this credential, this credential should not be hacked, or either it should not be misused. So in order to prevent this, there need to be an authentication methodology to be in place in the hospital. Not only the end user credential, there need to be a two-factor authentication. Just like, for example, if you try to open your Gmail, it will ask two-step authentication. It will send an security token to your mobile app, and also it will ask the password. Just like this, our hospital HMIS should also be also follow the two-factor authentication. And finally, the hospital uses a digital mechanism to protect and restrict data transfer and external storage. Hospital should ensure no data should be get transferred to the external devices. Sometimes the hospital staff within the hospital can try to copy the data from the system. It should not happen. In order to prevent this such incidents, the hospital should be have a system in place so that no data transfer should happen. And there need to be a proper protocol, and there need to be a mandate restrict encryption and password protection to access control and to safeguard the thing. And the hospital should always use an official email ID only to do any official communication within the organization. The hospital staff or any other stakeholder should not use their private email IDs, or the hospital should be provided with an official email ID, so that there will not be any leakage of the data from hospital to an individual. And the hospital should have an auto termination system, which means if a staff is working, or if a receptionist is working on a system, suddenly she would have gone for a break, keeping the HMIS open. What happens? This HMIS can be misused by another colleague of her. So in order to prevent such incidents, the hospital software needs to have an auto termination uh, methodology in place. And finally, the hospital maintain a record of all the periodic calibration, just like any other equipment periodic calibration maintenance plan. We usually maintain the physical record. So same manner, we should be able to maintain all the calibration and maintenance plan in the HMIS itself. And the notification should be sent automatically to the maintenance in charge or a biomedical department if there are any maintenance activities being scheduled, so that there will not be a delay in the maintenance plan. And again, the collection of biomedical waste from the hospital record should be detailedly maintained in the HMIS itself. And finally, I'll end up this session. Uh, the hospital should register with the ABDM, with the healthcare facility registry under ABDM. It's not only the hospital digital operation management, but to go robustly all over the places, the hospital should get registered in itself with the ABDM registry. Thank you.